Hello, welcome back to my channel. I'm Honey, one of the registered nurses working in the UK. Today we will be discussing about few of the questions that can be asked during NHS interview. So before moving on to the questions, let me tell you I'm not going to give you a prepared answer for any of the questions. Instead, I'm going to give you some tips or some points that you need to include in your answer. So let's move on to the question. Most of the interviewers will ask you to introduce yourself, or they can ask this question in different way, saying that tell me about your experience as a nurse so far. So to answer this question, you need to start from your institute where you have done your degree, and gradually you can move on to the hospitals where you worked, or gradually you can move on to your experience. But make sure that you always include one or two qualities that you gain from each of the institution, which will give a positive impression about yourself to the interview. And along with this, you can add one more point saying that what you like in your career. So that's how you have to answer this particular question. Moving on to the next question. If you're attending the interview from outside UK, definitely they're going to ask you a question. Why do you want to work in the UK? So to answer this question, you need to have some professional reason. Some career reasons. You have to say some career reasons before you say any of your personal reasons. So similarly, you can get another question saying that why do you want to work at this particular NHS trust? So make sure that you have done enough research on this particular trust before you attend any of the interviews. You need not to give any broad answers regarding this particular trust, but as I said you earlier, you need to say some career reasons before you say any personal reasons. Next question. They can ask what are the 6 C's of nursing. So you need to do enough research on the NMC code and 6 C's: care, compassion, commitment, communication, competence, courage. So you need to know what are the 6 C's, and you need to do some research before you attend any of the interviews. You need to know what are the NMC code, which usually they ask during their interviews. Another question. Can you describe your experience working in a healthcare settings? So to answer this question, you can always explain what you have done in that particular place. For example, like your job description, and then you can always include what are the qualities or what are the things that you gain from them. For example, like teamwork, you learn to work in a team. So something like that, which makes you special when you answer that question. But make sure that be honest in all your answers and always put yourself into the shoes of the interviewer, and just think whether would you hire such a candidate who gives such answer to your questions. So always keep that in your mind when you answer any of the questions with him. Next question. What are the qualities and skills do you possess which makes you a good fit for nursing? So to answer this question, you can always say what are your qualities. For example, if you are really good at communication, or you have really good leadership skills. So something like that you can always say. And along with that, you can always include some clinical skills which you possess. For example, if you're really good at cannulation and you know to read ECG very well, so all such clinical skills you can say to answer this question. Another type of questions that can be asked during interview is scenario based questions. So to answer these questions, you might have heard of STAR technique: situation, task, action, and results. So you need to follow this format to answer any of scenario questions. For example, they can ask you like you have seen one of your colleague making a drug error. What would you do in that situation? Or they might ask you like you have faced explain a situation where you have faced a challenging patient, and how did you deal with that situation. So to answer any of this question, you need to follow the STAR technique. Along with that, you make sure always whenever you mention any of your action, you need to mention that I followed the policies and procedure of that institute. For example, if you're talking about anything that happened during your experience, you need to justify your answer. There is nothing wrong in this answer. This scenario question can't be wrong anyhow. So whatever you say, whatever you have done, that is based on the policies and procedures of your institute, isn't it? So always you need to mention that sentence to answer this question. So when you answer in that format, that would be a bit more reasonable for those who listen to that answer. So we have covered few of the interview questions today, and we will see with the rest of questions later. So thank you for watching my YouTube channel, and please subscribe and like if you like it. And see you later. Thank you. Thank you so much. Bye bye.